All right, thank you, Patty. All right, coronavirus Q&A time where we get to separate, hopefully, the facts from the fiction and the fear that are out there. We are joined by emergency room Dr. Robert A. Frolickstein. Doctor, thank you for joining us as you do every Thursday. We really appreciate it. I like to start with just what are you seeing in the ER these days?
So not much has changed. We're still seeing a few patients with COVID that are getting admitted, but thankfully we seem to be having more patients recover in our discharge. So overall, I think the number of hospitalized patients with COVID-19 right now is down a little bit than it was last week. Overall, our volumes are still significantly dropped. It's maybe started to pick up in a few days, and the last few days, and that's good. That hopefully is an indication that makes people understand it is safe to come to the emergency department. You need to come to the emergency department if you believe you have an emergency.
And speaking of the hospital, we are hearing reports that things are kind of returning back to normal in some sense, at least when it comes to scheduling these non-emergency surgeries. What can you tell us about that?
Yeah, so I'd say it is starting. The process of returning to normal is starting, and certainly the governor changed his executive order. And prior to the change, it really limited any surgeries to only those that were emergent. And now it has relaxed that a bit, and now necessary, but not necessarily emergent surgeries are now being allowed to proceed.
We've been I know that the mayor talked about it a little bit yesterday about masks and the importance of wearing masks, and that some people still aren't wearing them. And we actually get questions here about people saying, if I don't have COVID, why do I have to wear a mask? Well, it's not so much about the person wearing the mask, correct?
Yeah, so I think there's a misperception out there that COVID is floating around in the air. And that's really not true. It probably does float for a very short distance from someone that has been infected with it, but then it quickly settles, and it probably settles within 6 feet of that person that is emitting the virus. And so that's the rationale behind the 6-foot rule. So, but the masks are really not necessarily intended to prevent me wearing a mask that it doesn't have the infection from getting the virus. The masks are really more designed for if I have it and don't know it, to prevent it from spreading around. Now, there is some protection for me if I don't have it, and I'm within 6 feet of someone who does, and they're not wearing a mask. Well, that's better than not wearing a mask, both of us not wearing a mask. So it does go both ways a little bit, but it's mostly to protect everyone else in case I might be infected with the virus.
You know, we've heard a lot about, and I think Dr. Anthony Fauci at the White House mentioned this today, about the second or third potential wave that could be coming months from now. How is the medical community here bracing or preparing should something like that come to pass?
So certainly, we're all concerned about the second wave and when that will be. We're very, very hopeful that it won't be, anytime in the next few months. It might hopefully wait till the fall, and that will give us time to really perfect the strategies we have in place already to keep the healthcare workforce healthy, as well as any patients who have to come to the hospital healthy. It'll allow us to build up our supplies of PPE, and probably most importantly, hopefully, it will allow all the brilliant people out there working on treatments and vaccines to have some time to develop some effective treatments.
Absolutely. Time is of the essence right now. Dr. Robert Frolickstein, emergency room doctor, thank you so much for joining us. And you're going to join us tonight at 9. We're going to take viewer questions, and I've already got a sneak peek of one of them. It has to do with pets and COVID-19. So I'm going to throw that one at you tonight at 9, and then, of course, we'll have it on the night beat. Thank you, doctor.
Thank you.
We'll be right back.